Secondly, ethical principles or values, for example, respect for autonomy or the do no harm to the patient, is the principle be at stake. Now, I would like to elaborate a little bit on this respect for autonomy and the do no harm principle. Respect for autonomy for the patient. That thing where we come and we just do something to the patient without really asking permission because we get so used to it. Autonomy for the patient to decide what can happen to his body. He has the right to decide until he gives his last breath. He has the right to decide, I don't want the morphine. I do not want the life support system. I do not want to be resuscitated on. But that in itself sometimes poses a conflict situation for us as the professional. Because sometimes we know of better. We know of better. Stopping the ventilator, if the patient says, I don't want this anymore, we know he's going to die now. But if the patient wants it, it's his autonomy that rule. But on the other hand, the do no harm beneficence principle tells us that we mustn't do harm to patients. So can you see the conflict situation which arises now? That you know of better, of the do not do harm, but also the right of the patient for self-autonomy, for his decisions for himself. And that on its own creates a conflict situation. Let me give you an example. With all due respect to any religion, religions that may be here. Have you ever been confronted, maybe sister there at the back, have been confronted with a situation where you have, remember I said I'm coming from the emergency services, where you hit the situation where the patient, it's a child, say it's a 4-year-old child, and the child was involved in a motor vehicle accident with bilateral open fractures of the legs, both extremities, and the child bleeds profusely, and the child's HB turns to be 6 and needs to go to theater, and we know the bottom line for theater call is HB 10. And the child's parents are Jehovah's Witness. They say, we do not believe our origin of faith says that we may not receive blood from any other person. Can you see the autonomy? Okay, in this, say for example, we change the situation and it's a 40-year-old man. The autonomy, his autonomy to rule over his own body says, I do not want blood. The conflict situation comes for the doctor and the nurse, but we do not want any harm to the patient, and we know of better. You have to receive blood before you go to theater, because how are we going to give you oxygen? It won't be carried by, we need blood, we need hemoglobin. Have you ever been confronted in a situation like that? And we have to respect that. Respect for the autonomy of the patient, right? Then there's the third characteristic is the situation involves the values of all key individuals participating in the situation. For example, the members of the disciplinary team. Another one, a tough one. I had a situation with a student of mine. She came to me and she told me that she is pregnant. She's 12 weeks or 11 weeks pregnant. She's not sure if the child is from her husband because they have problems, and she's with the other man. Sister, can you refer me? Where can I get in this place where we are now? I want an abortion. Now that this child has been referred, right? She's in distress because she now wants autonomy to rule for her own body. Okay? I have my set of moral values, what I believe. The doctor that I refer to for evaluation is maybe a pro-life doctor also, having his own set of values about abortion. The sister working in the clinic who has to lock out the cytotec tablets to start the abortion for her She has her own set of values. Can you see the multidisciplinary team involving in one person, everyone with their own set of values and norms? In Afrikaans, we call it a waardeuitklaring, value clarification, that we must make for ourselves when we come to do nursing. If you are, for example, if you are Muslim, the Quran will direct your value clarification for yourself. If you are Christian, the 10 Commandments normally directs our value clarification. If you are Jewish, the Torah sometimes, or the Torah would probably be your, I don't know a lot about that, but would be directly your value system. Because our morals and our values come from how we were raised, and ultimately the relationship with the upper being, the higher being. So can you see how everyone comes from different directions and walks of life to come and do nursing, but at the end of the day we work with a patient who has to rule for himself and his own body. And that creates a big conflict within our. Sometimes I used to work in a rural upcountry in my hometown, and if you are exposed to, or you obtain, or you get a stabbed neck, or a stab in the heart, a pericardial stab wound, you die because there's no life support. You see, you can open the patient's thorax with the emergency thoracotomy, and you can suture that little hole in the heart, and then what then? I'm asking then, what then? There's no life support to help nurse that patient at the end of the day. So what happened is, if you get a severe stab where the patient bleeds profusely, the patient is going to die. There are only 6 units of blood in that whole little town, emergency blood, or negative blood. So that is, now where's the do no harm principle? Where does it place me as the rescuer of the situation? And all of this, I hope you can get the feeling of the turmoil that this ethical dilemmas can cause, and cause in your inner being as a nurse, and you have to work with it. Other situation is, our registered nurses will agree with me. You come on duty and you have only 3 nurses for a whole ward of 35 patients. How is it possible? You may be 1 registered nurse and 3 auxiliary nurses. How is it possible that the registered nurse must do the drug round, she must do medicine round, the IV round, the wound round, because of the scope of practice? And at the end of the day, you're sitting there and you say, but okay, I'm taking this responsibility now to run this ward, but it's an ethical dilemma, because how am I going to care properly for all of these patients? The do no harm principle of a characteristic of an ethical problem. The general definition of what is an ethical dilemma and the problem. It is, can you see now that it's a debate between 2 moral principles, a right and a wrong? You are required to make a choice between 2 very critical situations. There's conflict between your personal values and your professional ethics as a nurse. It could also be defined as the best of 2 worst evils. Just think about it. The best of 2 worst evils. It's then when they say you're between the devil and the deep blue sea, because whichever way you're going to go, it's not going to be the best option for you. It can also be described as it is a moral dilemma. And it can also be described as, or defined as, a situation wherein moral consciousness or ethical obligations of the nurse conflicts in such a way that any possible resolution to the dilemma is morally intolerable. And we're going to come to something later in the lecture that I will hand over to you to sort out. And then you're going to see how you're going to fight inside of getting a proper answer. So how do I make an ethical decision then? Just think about this. Read for yourself on the board, and then you just think about that for a moment. Sometimes sometimes you think, I must do the right thing. Then it has a wrong outcome. But sometimes, even so, you have to do the wrong thing. You accept that responsibility as a registered nurse to run this ward with 3 nurses whom you know their scope of practice is not of what the care of the patient would require. But you accept that responsibility, which is the wrong thing, actually, but with the right outcome. At the end, the patients received some care. And if you can see an ethical dilemma and your decision making of when you are confronted with an ethical dilemma, if you can see it in this light, it becomes kind of bearable. I don't know. It's for us to decide. There's no right or no wrong when you have to make an ethical decision. That is the bottom line. You do something, the right thing. You do the right thing, and it has a wrong outcome. Alternatively, you can do the wrong thing, and it can have a right outcome. And later in the day, I would like for you to use this. I'm going to give you a case study or a scenario where you have to argue this thing, this definition of Smith 2017, okay?